So when it comes to helping children with autism, there are a range of supports and interventions that can be useful. I think what I'd like to emphasise is the most important thing is the work that our families do on a day-to-day basis makes so much difference that all the other therapies and interventions and supports, they're add-ons. You know, what our families do are amazing for our young people. However, there are other things. So having an occupational therapist involved who can help us identify the sensory profile for that young person and think of supports and interventions both at home and in school. You know, does that young person need sensory circuits before they make the transition home so that they don't have that after school collapse? Do we need to be able to have a couple of things in the house like spinning toys or peanut balls that help provide that child that rocking motion and that regulation? In addition to that, we've got speech and language therapy, working with therapists to be able to support communication and to make sure that these young people feel able to get their needs met in whatever method, you know, is most suitable for them. But then we also have psychological therapies, and the young people that we care for, they might not just have autism, they're likely to have autism and some other conditions. So you have 40% of children with autism have gastrointestinal difficulties. 30 to 60% of children with autism may have a co-diagnosis of ADHD. Being able to access, you know, therapists like me and having that support, we can begin to understand if there are other difficulties going on with the young people. We support our families to be able to you know, work to meet the children's needs and maybe understand in other ways what are going on for these young people. So it is a real team approach, I think. And I think it's also giving those young people a space to reflect and identify and make sense of who they are. We can have a lot of questions for young people with autism around their identity, and being able to give them that space to explore and process that safely is really valuable for them. So for ISP families, young people can have access to therapy, unlike some other organisations where that has to be sought permission from local authorities, or you have to wait for CAMs and things like that, and some of their waiting lists can be up to 2 years. You benefit from being able to access therapy as part of the placement. It's already funded and agreed, so there aren't those kind of waiting lists that young people often experience in different settings. So young people will get matched with what we hope is going to be, you know, the right therapist for them, with the right skills, the right understanding, the right intervention and modality, and they will be able to access therapy on a weekly basis for that. Sometimes young people with therapeutic needs may not be able to access the full time because of their developmental needs. So sometimes those sessions might be a little bit shorter, particularly in the early stages. In addition to that, you will be able to have the therapists attend professionals meetings and be able to be the voice for the young person, the voice for the placement alongside their social workers. But as well as that, ISP families also benefit from actually getting monthly consults with their fostering, with their therapists rather. So once a month, I will speak to my families, and we will have this dedicated hour where we can sit and think about what's going on for that young person, how can we help them, what differences can we make. And it's that real emphasis about, you're not doing this on your own, there's a team of people around you to support this. And you know, I get texts from my families letting me know, you know, how their young people are going in between sessions as well. So it's a really supportive environment.